My kidney cancer journey started when I was diagnosed with liver cancer in 2010, in September. In December 2010, I was referred to Everett Hospital in Cambridge to be assessed for a liver transplant. I had numerous tests over 8 days, and I'll never forget the morning of 22nd of December 2010, when the doctors came into my ward. They walked around all the beds, spoke to the patients, they came up to mine, and they pulled the curtains round. They all looked very solemn, and I thought, hello, something's not quite right here. And sure enough, Dr. Alexander looked at me and he said, sorry to tell you, but you know about the tumour on your liver, but I'm afraid to say you've also got one on your kidney. Well, and they suspected it's spread from my liver or vice versa. My daughter was getting married in June 2011, and I asked the question, should I bring the wedding forward? One of the doctors said, perhaps you ought to. Dr. Alexander turned around and he said, Wilson, he said, let's not make any assumptions. Let's get you back to Southampton Hospital with our findings, and they'll decide whatever needs doing. So it was a real unexpected shock to find out I had a kidney tumour as well as a liver tumour. But at the same time, I'm glad that I went there for that scan, because I would have been totally aware of this kidney tumour and how far would it have gone before I'd realised it. Anyway, needless to say, I didn't have a very good Christmas that year. Bit of worry and a bit of stress. Meanwhile, my wife and I kept in contact with Dr. Kate Nash, who is a hepatologist at Southampton Hospital. Due to the size of liver cancer, it was decided that surgery was not an option. And after a meeting with the hepatology and renal departments, it was decided that I needed to have 2 separate procedures, as the tumours were unrelated. It was arranged for me to visit Mr. Hayes at the Royal Southampton Hospital in Southampton. I went to see him on Friday the 11th of February, 2011 that is. He told me it was decided that the radiofrequency ablation on the liver was priority, and that an appointment would be made for 8 weeks later to discuss further treatment for the kidney. I left that meeting feeling very uncertain of my future. My wife and I arrived home, and I had to pop out for half an hour or so. When I came back, Dr. Breen's secretary, who at the time was Ali, phoned and said they needed to speak to me as soon as possible. So I phoned back, and I was told that Dr. Breen had taken interest in my case, and I was asked to go in for a pre-op assessment on the following Monday. As things had changed considerably now that Dr. Breen was involved. I met Dr. Breen for the very first time on that Monday, and he immediately put me at ease by stating he was at both tumours under the same anaesthetic. He told me he planned to use cryoablation on my left kidney and turn me over and use radiofrequency ablation on my liver, which would be performed on a CT scanner by itself, his anaesthetist and the rest of the team. On Wednesday the 16th of February, I was prepped for the procedure. I went into the CT scanner room, anaesthetised, and woke up sometimes later outside the scanner room, where a nurse told me everybody involved was very pleased with the outcome. I've since been told that I'm the first person in the world to have had these 2 procedures done at the same time, and as far as I know, I'm still the only person in the world to have it done. I stayed in hospital for 4 days, feeling a bit groggy. The keyhole for the cryoablation went a bit weepy for a few days. Apart from that, I recovered well enough just to have a few weeks off of work. Even though then I realised I had to be careful, and I eased myself back to work part-time, gradually building up to full-time after about 6 weeks. I've since had a lot of scans of my liver and kidney. So far there have been no signs of a recurrence of my kidney, but unfortunately in May this year I was told I had another tumour on my liver. Though much smaller than the last one, it was treated successfully as the previous one with radiofrequency ablation performed by Dr. Breen. I sincerely believe that if Dr. David Breen had not taken on my case, I would not be alive today.